Hi everybody, this is Kaylee. I'm one of the PTs at Breathe Physical Therapy and Wellness. I'm actually home right now on maternity leave with my little baby. So if at any point I have to hop over and get him, he is sleeping right now. But I'm just here to talk about scar tissue massage for C-section scars. So C-section scars, this is my second birth. My first one was vaginal birth. This one turned into an unplanned C-section, not emergent, but still cesarean nonetheless. So I've had to I've talked with patients about this for the last 3 years, but now I'm finally getting to experience it myself and how to do scar massage. So I want to talk to you about all things scar massage, how to do it, when to do it, why to do it, what could happen if you don't do it. Scar massage for C-sections, I am always surprised at how many women who have a cesarean and they come in to Breathe and they're working with us and we're like, oh, have you ever touched your scar? Have you ever done massage on it? And how many women have said no? And whether it's because they just are kind of like, ooh, I just don't like to think about it. I don't want to look at it. I don't really care to touch it. Or nobody ever told me to, so I just never did it. And they're like, sure, yeah, I'll do it. Nobody just told me to. So we are here to tell you, touch your scar, massage your scar, all of the things, whether it's a cesarean, whether you just had a knee replacement. I've had elbow surgery, same thing. If you had, whether it's like a breast reconstruction or augmentation or breast cancer and removal, anything you have, scars, touch them, massage them, move them around will help everything heal better. Why to do it specifically for cesarean? It will help proper healing. It can help less adherence. And when I say adherence, kind of like when it clings down, so they're cutting lots of layers in deep, so it helps so that it's not as adhered to all of those layers and different things that are in there. It can help your scar to heal flatter, so the appearance of the scar itself less bumpy or puckered, or different things that you're looking at and you're like, ooh, I don't really want it to be like that. It can help it to lay flatter and visually more appealing for you. Less shelving, some people on that appearance side of things. Some people notice with that adherence, when it's tucked under, you get kind of like mommy tummy or the C-section shelf or things, if you've heard any of those words. Pretty much that scar is adhered to those tissues under, and so your skin is kind of hanging over it. So again, it can help it so that it's not adhered under, lays flatter, smoother, less shelving. It can also help in sensation, so it can feel numb, tingly, uncomfortable if your kids are jumping on you later, or you have pants or underwear or anything like that. It can help it to be more comfortable, better sensation, all those kind of things. Also, I know lots of women who have had cesareans are still potentially looking at another birth or another cesarean. So this can help for decreasing your risk for uterine rupture, which is a huge risk with C-section, multiple C-sections. So you're helping that scar tissue to heal up better, going into another pregnancy and another delivery and another cesarean section, if that's what's in your future. So when to start doing it? We talk about, if you buy our planned C-section book that our other PT and co-owner Molly wrote, she talks about everything cesarean, but she also goes into detail. There's pictures, there's videos of all those things, scar massage. But as soon as you get home, or even sometimes, things are a little bit tender in the hospital, but as soon as you get home, you can start scar massage. And when I say scar massage, it doesn't necessarily always mean right on the incision. So I tried looking at the camera and trying to do my own, and it was just really hard to do with the angle and all my things. So I got really fancy and I drew it for you guys. So I'm gonna show you how to do scar massage, all the things. Also, before I do that, real quick, some things that I've been using on myself for oil to do my scar massage with is definitely vitamin E oil. This is the one that I got off Amazon. I got it because it is natural, but clean, all of that good stuff. This is vitamin E oil. Get a good vitamin E oil. This helps the scar tissue itself heal better. It helps to break up some of the adhesions, the thickness of it too. So this is great. Vitamin E oil is great to use as like your base with doing scar massage. If you want to get fancy with it, you can also add essential oils. So I've been adding some essential oils to mine. Frankincense. I don't know if you guys can see this, so I'll just tell you. This is doTERRA. Frankincense is like the holy grail of all your oils. That's going to help with healing. It's going to help with appearance. It's going to help everything. Frankincense does everything. If you want an all-in-one, frankincense is very good for healing. Melaleuca or tea tree. This is going to be very good for skin appearance. So if you want it to, like, if you think skin blemishes, like if you have acne or whatnot, or scars from acne, and if you've ever heard, oh, I have tea tree in my moisturizer, it's because it helps with skin blemishes and appearance. So that's good for decreasing scar appearance. Oh, sorry, this sun is like blaring on my face. And lavender. So lavender is also, I like to do it because it's just relaxing, but also it is antimicrobial. So it can help if your hands, obviously wash your hands before you do it. But this is good for making sure to try to decrease risk for infection. Also, if your kids get a little boo-boo or a little cut, toss a drop of lavender on it. It's good for that too. Okay, so once you get home, I'll show you on my fancy little model. So obviously this is our person. Here is her scar. Here is her belly button and her legs, clearly. Once you get home, you're not going to start right on the scar because they're depending on your surgeon and how they closed it. You might have staples, you might have stitches, you might have glue, you might have steri strips or a covering. Any of those kind of things you might have. Oh, someone just asked what was the brand of vitamin E oil again. This is the one that I got. It's Eden's Simila. I got it off Amazon, and it says it's 100% natural, which is why I went for this vitamin E oil. It's also mixed with organic rose hip and jojoba oil, so I like it. And my skin's really dry around my incision, so I use this just on the skin above and below. That's just really dry from all the bandages that I had on top of it when it was healing for the first 2 weeks. So I like it for that too. Okay, so first, once you get home, and for about the first 3 weeks or 21 days, whatever you want to look at it like, until you go back and meet with your doctor and kind of talk about things, how it's healing, if you can get more aggressive with it, you're not going to be touching directly on your scar. So what we're going to do with that is, if I'm laying down in bed, I am going to be starting with light massage. So I'm going like up and around here, and this is literally how I would do it. So I would just kind of massage up here. I would go down into my hips. The hip flexors get really tight. So again, I'm not touching right on incision. Rubbing down in my hip flexors. And I'm not super comfortable with stretching my hip flexors at this point because I don't want to risk tearing open my incision. So massaging them feels good because everything's just super tight. So massaging down here, again, not super aggressive right now, pretty light. You're not wanting to tug the skin. Massaging above. You can kind of try to massage below, but there's not much room at this point because obviously you're going to hit your pubic bone, you've got bandage, or you've got whatever you have here, depending on what they chose to do for you. If there's room, you can, or up above for sure. So gentle circles. If something's tight, you can gently kind of hold it. Take your hands kind of like this, and you can, okay, I take that back. Don't do that part until after 3 weeks. So just gentle massage all around, above, to the side below. Something that I liked to do as well, definitely not directly on the scar, but if I had my underwear on, or let's be real, if I had my little diapers on that I wore postpartum for the first couple weeks, I would gently kind of like, and again, this is super light, like that's about the amount of pressure I would do over my underwear, just to kind of get that sensation to start coming back all around that area. I'm just almost like stroking it like a feather. When I'm in the shower, I'm letting water run directly on it because you want it to be clean. You just also want to start getting used to things touching around that area. So even just stroking all around that area, it's covered. You're not touching directly on open wound. Gently doing that will help to increase sensation. As the weeks are going on, past like 3 weeks, start doing that with different material. So like your loofah in the shower or whatever you're doing, and once you're able and your doctor clears you to go straight on it, get different textures. Do it with a cotton ball, do it with a again, your loofah. Later, after like 6 weeks, when it's for sure healed, you could get with more abrasive materials like a toothbrush, or like rubbing straight on it, different things to get it used to. You don't always want to be like, oh my God, it's always tender, it's always hurts to wear pants, it hurts when my kids jump on me. The more you touch it, the more different materials, the better that will help sensation and discomfort go away. After you are, right now I'm 5.5 weeks, so I'm starting to get more aggressive with mine. When you're in that window of clearance, definitely 6 weeks on, you start to get more aggressive. And when I say that, we're going to get right on the scar. We're doing deep circles right on it. We're rubbing it. Some parts are going to be more adhered, so get right in there. If that side, like I've got a little bump over here I'm really trying to work out, so I'm rubbing in through here. I'm definitely using some of my oils in this area to help with the healing. So deep circles. I'm also then taking my fingers right above, and again, this is after it's fully healed, definitely 6 weeks. If there's different situations where it could give or take, generally speaking, 6 weeks is like, you're good. And you haven't had any problems. Pressing down into my skin, and then pulling my skin up and holding it. So if this was a true scar, and I'm pulling my skin up, it would move with me. That's goal. If scar's super adhered, I could pull the skin and scar does not move because it's so adhered. So goal would be able to get it to move just like the rest of your skin would move. If you pull and one spot doesn't move, focus more attention on there. So maybe my left side's tighter. So I'm gonna pull that up and I'm just gonna hold it there. And what you're doing is you're helping to do myofascial work to break up some of those fascial restrictions down deeper. So you can do deep circles right on it. You can get close right to that scar, pull skin up, hold it there. And when you do that, if you notice, wow, this part really isn't moving as much as this part that looks really good is, then get right into that spot and hone in your attention there. Also, you can do this below at the same way. So this would be realistic. I'm not going to be able to pull like that because you just can't reach unless somebody else is doing it. So you would do this way and push or out to the side. All directions are good. Other things you want to do is lifting. So taking your fingers and trying to lift that scar. So what you're doing there is it's adhered down. So you're trying to lift to get it to not be so stuck down and pucker. That will help with like the shelving appearance. Also, you could do skin rolling. We're gonna try to skin roll some paper. Skin rolling's kind of hard to do on yourself. I've been trying, and mine right now is pretty stuck down, adhered. So I'm really trying to work on things like this, deep circles, and I'm trying to lift it like this as well, because I want mine to heal as flat as possible because of, appearance, who doesn't? But also, I have hopes potentially for another baby in my future. Who knows? So I want it to heal good so that if I do go into another cesarean or just pregnancy in general, my risk for uterine rupture goes down. So picking it up, yeah, I don't think this is gonna work. I'll show you on my arm. So picking up the skin, I don't know if you guys can see that. And then roll, this is kind of hard. Rolling, so my thumb's not moving, but my skin is moving. So if I had a scar right here, so if my scar is going this way, pick it up, and I'm rolling right on top of my scar, the length of my scar, trying to break up some of that fascial restriction right under that scar. You can do it both directions depending what hand you're doing. All of these things, if it's hard for you to do on your own, you could ask your partner or whoever's home with you to do it, or come in to Breathe. We can help you. We can also do dry needling on scar tissue once it's healed. With that, it sounds scary. Actually, I haven't done it on myself yet, but I found with patients, it actually is not as uncomfortable as potentially dry needling other places in your body. We're not doing trigger point release. So you're not gonna get like those twitches that you would if you've had dry needling before with us that we're looking for, because we're not necessarily doing muscular releases here. We're doing fascial releases. So all of that scar tissue restrictions below there, we're picking up your scar. We're taking that needle and we're just putting it right under. And a lot of times you don't even feel it. And especially if there's numbness in this area, even more, you're not gonna feel it. So it sounds scary, but don't let this creep you out. We'll go right under, and that could be enough. We could just sit that there and then pull it back out, and that will break up some of those fascial restrictions on the way. If we wanted to do more, we could put that needle in through, so we're going under that scar, let that kind of lay out, and then we can take the needle and kind of twist it to break up even more fascial restrictions underneath it. That can help a lot to let it lay flatter, bring back, help it heal up better, help with sensation over time. Continuing to do it, we can target one certain area or we can do it along the whole incision. It kind of just depends on the person. So definitely important to treat your scar. Touch your scar, use different textures, touch it over your pants, touch it in the shower, use oil, use your loofah, pick it up, rub it, all of the stuff. Rub your hips, rub under your belly button. Mine's really tender right up here and it feels thick. So I'm making sure I'm giving this area a lot of love. All of it will help it to become less uncomfortable, feel better, heal better, go into a next pregnancy better. Also, it can help to preventing back pain stuff related to scar, like back pain, constipation, leaking of urine, or other things. Core weakness as you're starting to get back into exercise, using your belly muscles, and just kind of self-confidence, image, and all the other things going into subsequent pregnancy safety as well. So that is, I think that I talked about what I wanted to talk about. If I forgot anything, drop it in a question, read the ebook that Molly wrote. You can look at our website. I'll drop a link that you can go look at this planned C-section book. That's also, so if you know you're gonna have a planned C-section, great, buy that definitely if you're one of our clients. We give you a discount too. But like myself, I wasn't going into a planned C-section. I had I feel like I'm crooked. I had a C-section, so then I made sure and I reread the book after. So you can obviously get it after then too. So that is all I have for you today, and my baby decided to keep sleeping through this, so that's a win altogether. Have a great day. I can also drop the link for that oil if anybody wanted to, and then the doTERRA oils we sell in office, or you can buy them online. We can help sign you up for that. All the good things. Okay, let me know if you have any questions. Bye.